Hello everybody, welcome to UroChannel. Cancer is something that only affects old people? Not quite. There are some forms of cancer which predominantly occur in our younger years. Testicular cancer is one of them. It roughly happens in the third and fourth decades of life, and there has been a rise in the industrialized countries over the last years. Testicular cancer now represents 5% of the urological tumors. Why does it happen at a young age? Because in most cases it is a malignancy of the sperm-producing tissues, and in young men, cellular turnover in this area is at its peak. Any irreversible damages to the DNA will multiply more rapidly during these times of rapid cell division. So cancer has a good chance here. Good news is that testicular cancer is quite easy to detect at an early stage, and it is one of the few cancers that are curable. In the early stages, as close as you can get to 100%. Even in the late stages, cure is still possible, but not for everybody. Lance Armstrong is a prominent example of a survivor of late-stage testicular cancer. What you need to do at any age, but especially during the most susceptible years, is self-examination. The testicles are very easy to examine because they are located outside of the body. As you might know, the scrotum has a muscular layer, the so-called cremaster muscle. When it contracts, the testicles are lifted upwards. This position is not ideal for self-examination. When you take a warm shower or a bath, the cremaster relaxes, and this is a good opportunity for examination. I advise you to use both hands when you do it. Take one testicle with the first 3 fingers of each hand and gently roll it. You do this maneuver until you have examined the whole organ. A normal testicle has a smooth surface and is slightly elastic. On top, you will be able to palpate the epididymis. It feels almost like a raisin. Anything hard as stone, any lumps and bumps don't belong there. It is also possible that the testicle is enlarged and very hard. Testicular cancer may occur bilaterally, but this doesn't happen very often. So if in doubt, compare your findings with the other side. If there is an obvious difference, your finding may be suspicious. However, differences in testicular size can be seen very often. It is the texture that is important. Cancer is hard like a rock. A hard testicle that seems to increase in volume over time should be presented to a urologist immediately, as any unusual finding should. Ultrasound is an excellent method to detect tumors in the testicles. There are also benign diseases which lead to enlarged testicles. Hydrocele is one of them. It is a harmless fluid collection in the scrotum. Epididymitis and orchitis will also lead to scrotal swelling. Testicular torsion as well. Anyway, there is one more thing that you need to know. Cancer does not hurt in the beginning stages. So when you are bothered by testicular pain, chances that this is cancer are actually quite low. This is what makes cancer so dangerous. In the beginning, you feel completely healthy. I would like to repeat one thing I already mentioned in the beginning. There is a very good chance to be cured from testicular cancer. The earlier it is detected, the better the chances and the less aggressive the treatment. The testicle will have to be removed though when there is cancer, but life with one testicle is no different from life with 2 testicles. By the way, I already uploaded some videos about conditions I mentioned in this video. I will put them in a playlist and place it at the end, so that you will be able to watch more of the respective topic. Here's what you should not do. Don't ignore changes of your testicles. Embarrassment and fear are bad counselors in this scenario. Sadly, it happens time and again that young men become aware of a testicular tumor and are too afraid to tell anybody. This must not be done, as it lowers the chances for survival and additionally equals more extended treatment. Please subscribe to UroChannel if you haven't done so, hit UroLike and click the bell so you won't miss out on new exciting content to come. Here's the playlist I promised you with additional information. Thanks for watching. Bye bye.